What's up, good people? Hope you guys are doing great today. I am going to talk about a very interesting topic today, and many people, millions of people experience this problem, and it's called motion sickness. I myself used to go through that kind of problem, and then I studied it and I found out different ways I can avoid that kind of problem. So, motion sickness is basically when you are in a car or in some sort of ride, you end up having nausea and you end up having throwing up or vomiting, and that kind of whole scenario develops and you're not able to function properly. So what can we do about it? First of all, let's say you are riding in a car and you're being motion sick. If you are able to take over at the driving side instead of being the passenger side, that's a really good alternative, because scientifically it's been proven that you end up having more motion sickness if you are sitting on the passenger side compared to if you're a driver yourself. And if that's not possible for you, let's say you are underage and you're not able to drive, or you don't have your driving license, then what can be done? Uh, then face the direction of the drive. Do not look on the other directions, or do not get distracted by different directions. Let's say don't look in the back, don't totally look opposite to the direction of the drive. Do not look in the windows to that extent. Do not focus in that kind of direction that is totally opposite or tangential to your driver's direction. That will help as well. Or you can have some distance focusing techniques done. By that I mean, instead of looking closer, which is very dangerous, is essentially for motion sickness, and actually looking closer, like let's say reading a book while you are in the car, or you are riding, reading that book, or using the cell phone, or any sort of near focusing can lead to motion sickness. So the focusing technique in this case is a reverse technique. By that I mean, you're gonna have a distance focusing. You are the passenger, you're not the driver in this case. So you are going to find a distance target and focus on that target and do the distance focusing. That's gonna take away your nausea. Or open the window, get some fresh air. Or you can even stop the car and take a fresh breather, and then get on to your journey whichever way you're going. Some people, and even the research supports that some people get benefit by taking something really light, let's say crackers, or taking a sip of cold water has also been proven to be helpful for motion sickness. Or even the carbonated drinks have been proven to be beneficial. The cold carbonated drinks have been proven to be beneficial for the people who get motion sickness. So you can get that kind of quick therapy to yourself and don't end up into the hospital. And make sure you do these things pretty early on. Do not let yourself fall into the trap of nausea and vomiting, and then say, oh, I'm gonna do distance focusing, or I'm gonna open the window, or I'm gonna take a carbonated drink. Sometimes it's too late for that kind of management to help you. Also, distract yourself. Distraction therapies have been really proven to be beneficial in people who get motion sickness. What sort of distraction you can have? You can start talking to someone, talk to the driver, or talk to the people around you, or call somebody and talk. Talking has been found out to be a really good technique to avoid motion sickness. Or another distraction that has been found to be proven to be useful in motion sickness is music, or some sort of recitation that you can listen to. Whichever recitation or music or anything that you like to hear or that helps you, that should also be very beneficial in this context. And another thing is change the position. Research says that changing the position has been very beneficial in self-treating your motion sickness. By that I mean, if you are sitting down and you have tried all of those things, please try to lay down. Some people get benefit from laying down and their motion sickness goes away. Some people, on the other hand, according to the research and the clinical experience, some people, on the other hand, get benefit from standing. So let's say they are riding a car and it's a long drive, and all of a sudden you start having motion sickness. You have to park the car somewhere and stand. By standing, I mean literally getting out of the car and stand up, walk around, and then give it a breath, give it some time, and take a good breather, and then sit back into your car. By then, the motion sickness should have dissolved. If all of these things are not helping, that means most likely you need to see your doctor immediately. Please like, subscribe, and share to my channel. Thank you so much. Bye bye.